Hey, Chad.
Hey. You know the prom? Well, we could go. You and me. Together, you know.
That would be lovely.
I'll call you. About the time and stuff.
Thank you, Chad. I know it will be a wonderful evening.
Yeah, whatever.
That was so sweet of you, Chad.
You happy now?
My happiness is not a factor here. Yours and Lisa's all I care about.
My senior prom, and I have to take the biggest 0 in the class.
Oh, she is very nice and desperate not to leave high school without becoming a woman first.
You must be kidding.
Just close your eyes and dream about being in Stanford Red, scoring the winning touchdown. Your oh-so-proud parents watching from the stands. Of course, that would require passing trigonometry.
You said you'd get those answers. The test is next week.
You'll have them in plenty of time. I promise.
I can't believe you're making me do this.
I'm not making you do anything. You always have a choice. Except when you pass trig and it comes time for the prom, don't you stand her up. It could be very dangerous breaking a promise to a woman.
Yes, the answer to that is yes, you certainly can help me. Thank you.
You're welcome. Oh, you got a lot of stuff here.
Well, I'm teaching a module starting today. I think maybe I'm over-prepared.
You must be Dr. Sloan from Community General Hospital.
Yes, I am. How did you know?
I'm taking your class. I'm Noelle Landrew.
Hi.
We are so looking forward to your lectures, Doctor.
Well, I just hope I can live up to Northern Hall standards.
No problem. Our students love a good intellectual debate.
Debate?
Oh, my third grade teacher brought one of these to class. It's a nice touch. Noelle? Oh, here, this is our room. I'll be in a minute.
Thank you very much.
I heard about you and Chad. I'm so happy for you.
I can't believe it. How did you get him to ask?
I think he secretly wanted to get together anyway. And then, when I told him how you felt.
Oh, but now what do I do?
You get a new dress and then fit right in with all the other beautiful seniors.
Well, how do I know it looks good on me? I've never had a dress like that. And flowers, I'm going to have to tell Chad the color of the dress so he knows about flowers.
We will find you a dress, okay? You just enjoy this, okay?
And with the increased use of the blue-green algae derivative FK507, organ transplantation has reached what a lot of people believe is optimum efficacy. Any questions?
I do, Dr. Sloan.
Yes, and you are?
Kelly De Niro.
Kelly?
Okay, I was wondering, isn't the real issue here vis-a-vis transplantation that of vital versus non-vital organs?
Well, that has been a subject of debate.
Well, for instance, the man who had his larynx transplanted recently. The argument was raised that it was an unnecessary surgery since the larynx is hardly vital.
Well, if I couldn't talk, I think I would find it vital.
But, it hardly meets the same critical care criteria as, say, a kidney or a liver. And is it worth the time and expense to maintain computerized waiting lists or even do the procedure?
Eric Fincher, Doctor?
Yes?
You're actually making a strong argument in favor of cloning body parts.
Cloning?
That seems presumptuous as a logical conclusion.
Not really. An individual's crust or diseased larynx could conceivably be cloned to provide a perfectly matched replacement. We might even see the day when autotransplantation or autotransfusion make cadaver replacements obsolete.
Normally these gel packs are good for muscle pain if you heat them in the microwave for 30 seconds, not 30 minutes. Hey. Some sulfadiazine in a gauze dressing.
Yes, sir.
Where have you been? You disappeared after lunch.
Jesse, I've been reassigned.
You're kidding. Who do I complain to?
Nobody. I asked for the transfer.
You didn't tell me you were going to do that.
I didn't want to say anything until I was sure.
But I like working with you. This isn't your way of trying to break up with me, is it?
Of course not. I got into nursing because I want to take care of people, not just shuttle injuries in and out of the ER.
Shuttle? Well, you know, this is important work.
I know that. But we lose track of people when they go up to surgery or into the wards. I miss that.
You miss bedpans?
You know what I mean.
I know what you mean. You miss knowing what happened to the patient afterwards.
Exactly.
I'll tell you, though, that kind of follow-through can be difficult to deal with sometimes.
Meaning?
Meaning that things are different in the ICU. You know, there's none of that pulse pounding, blood spurting, get me a liter of Ringer's lactate, and I mean now kind of thing.
I know, but it is still critical care, and I am really good at that. Or don't you think I can handle it?
Susan, I think that you can handle anything you want. Just remember, I'm here if you need to talk.
Or do other things?
Bye.
There is no way Allison Bradford is going to be a cheerleader. But she's so eager. She walks like a duck, has ankles like a rhinoceros, and talks like a mouse on helium. You can teach her, Shannon. You are at best. We have the finest cheerleading squad of any private school in the city. I'm not going to screw it up just because you think it would be good for Allison's self-esteem. I know. You're right. I was just making a suggestion. I was only trying to help a friend. I know you were. You help a lot of people. I just can't do this.
Is everything all right?
Everything's terrific. So how was the guest lecture?
Total dullness.
Oh, that's too bad. I have a class next time. You and Kelly were so charming in that lecture, debating your little hearts out. You're a perfect couple.
It'll never happen.
Yes, it will. Oh, Shannon needs her bike fixed.
Why doesn't she ask me?
Because she doesn't know it's broken. And she can't get you the one thing that you want the most. I can.
You can?
Kelly, star of the debating team.
Dr. Sloan, sorry about taking over the class that way.
Oh, don't be. You did a lot better job than I did. I didn't realize the students here were so...
Up on the issues?
Well, I was going to say argumentative. I like that better.
This is Norrington Hall. If you're not current on the issues, you die GPA-wise.
You and, Eric, is that his name? Seem to be enjoying yourself today.
Eric would debate his own reflection if he thought it would argue back.
Sounds like you're good friends.
I like Eric a lot. But, you know, there's homework and helping my parents out with the cafe and the debate team and student government.
Your parents own a cafe?
Not everybody has a rich father.
Sit down. Put your head between your legs. Now take a very deep breath. Very slowly. Take your time. There. Okay?
Oh, I'm a little embarrassed.
Oh, don't be. Do you have anything to eat today? Uh-huh. Yeah. I always pack too many oatmeal cookies.
No, it's okay.
No, don't argue with the doctor. I'll give you another boring lecture.
I know. I need to slow down and get some sleep.
Mm-hmm. And I want you to come into Community General for a complete checkup.
I don't have time. Sorry. No, maybe I better take another cookie for later.
Here you go. You know, Kelly, what you need to do is not skip meals. And you should arrange your schedule so you have more time to rest. And maybe, schoolwork being the first priority, you shouldn't work at the cafe anymore.
My parents can't afford to hire any more help. Not if they're going to put me through school. Look, thanks for the cookies, Dr. Sloan, but I know how to handle my life, and you don't. I've got...
So I'll call you later?
You better.
You get a burger or something.
Shannon will do the right thing.
But trials are next week. If I don't make it, my life is over.
Don't worry, Allison. You deserve to be a cheerleader, so you will be.
You're a bigger dreamer than I am.
patient. I promised, didn't I? And I always keep my promises.
Wow, well, are you okay?
Don't worry. I mean, Dr. Sloan just panicked. Call 911. Looks like you're gonna get your tryout after all.
Yesterday, we took a look at the scientific basis for cloning. Today, I thought we might discuss some of the ethical debate that's surrounding that subject.
No. You've been here 2 days, and all you've talked about is transplant this, and cloning that, and fetal tissue, whatever. Shannon died this morning. How does that fit into your ethics?
I want to tell you something about doctors, Chad. We don't know very much. And what we do know, we learn by accident. In emergency rooms, battlefields, overcrowded wards. Little bits and pieces of information the human body sees fit to give us from time to time.
Then how do you ever know how to treat someone?
By taking those observations and really making a leap of faith that what we're seeing is true.
You're talking about crossing your fingers and guessing. Real scientific.
Medicine's as much of an art as it is science, Chad. And it's going to take both to give us any direction for future research and treatment.
That doesn't have anything to do with Shannon. She doesn't have a future.
I think it has everything to do with Shannon. Medical science would say she had a massive head injury, which herniated the brain, destroyed the brain stem, and led to a cessation of life-sustaining functions.
That's cool. What about medical art?
That would be Shannon's doctors using new techniques to reverse the irreversible. And then using what they learned to help the next person.
Shannon's still dead.
I know, it doesn't even make any sense. But it will, Chad. I promise you all that. Shannon's death is going to make a difference.
Well,
It's a sad day, isn't it, Eric?
thanks to you.
I didn't loosen Shannon's front wheel.
You told me to.
I made a suggestion. You chose to do it. Now you can choose to shed tears over Shannon Murphy or rejoice over what you're about to receive. Which do you prefer? Hmm?
Hey, Susan. I've been looking all over for you. Then maybe you and I can go grab... What's wrong?
Leave me alone.
What happened?
Nothing. A patient.
Did you lose one?
Yes, I lost one. Are you happy now, mister? Follow through can be hard.
Hey, stop that. Come here. It's that girl from Norrington Hall, right? Look, I was on duty yesterday when they brought her in, and we barely got her stabilized enough to get her to the OR.
Well, she didn't make it, all right?
Okay, don't get angry at me about it.
Well, I had to get angry at somebody.
Susan.
She was only 17. I just had her parents sign the papers to donate her organs.
Oh, I told you things were going to be different in ICU.
So what? I'm not supposed to care that I sat with her parents all night watching her EEG flatline?
No, you're supposed to give them something calm and reasonable to hang on to because that's what nurses do.
So now I'm a bad nurse.
I didn't mean that.
Thanks a lot.
Susan!
George, what are you doing looking at a menu? You've had the same thing every day since I was 3. Dr. Sloan.
Hi.
Hi, would you like to see a menu?
No, thank you. You know, I came here to see how you're doing.
And?
You look fine.
I like to stay busy.
Well, I never doubted that. It's going to be hard leaving here, I'll bet, when you go to Berkeley, isn't it?
My parents have worked hard to get me there. I'm going to do everything I can to make them proud. Dr. Sloan, hi.
Hi.
Thank you for trying to help in class today.
Well, I'm not sure it did much good today.
You never know. Callie, we need to talk about those homework assignments you want me to pick up for you. I hope tomorrow goes as well, Doctor.
Thank you, Noel. Well, I'll let you two talk.
Bye. Isn't it nice to know a teacher cares for once? I really do appreciate you helping me with those assignments, Noel. But you know I didn't even ask for that. Oh, you're welcome. If there's ever anything I can do to repay you, there is. Eric Fincher and you are really made for each other. It's nice of you to say, and he would really like to get together. Do you know what I mean? That's between me and him. Just think of me as that Puritan guy. You know, the go-between. Or think about it as a return favor for that homework. Whatever makes you feel good. I won't do it. You have no right to tell me to. I was just asking. Well, then the answer is no. What are you doing? Oh, dear. A cockroach. Whatever will the health department say? What will your parents do? A place like this can't afford to shut down. Not even for a day. You would do that just to make me sleep with Eric? Oh, and you know what they say. If you see one, there are probably thousands in the walls. Eric's my friend. I won't do it. One anonymous call, and this place could be history. Oh, all right. Just leave my parents alone. Eric will be so appreciative. And you may even enjoy it.
The heart is dilated and pale, consistent with ischemic heart disease and cardiomyopathy.
Hey, Amanda, can I, I'm sorry, you're busy.
I'm never too busy for you.
Thanks. You know, how do you keep from getting too emotionally involved with your patients?
Well, Jesse, all of my patients are dead, so getting emotionally involved isn't really even an option.
Oh, yeah.
You having trouble with a patient?
Me? No, it's, Susan.
Susan Hilliard? I wouldn't worry about her too much. She's one of our best ER nurses.
She was until she got herself transferred to ICU. She wants to become more involved with her patients.
And so she's lost sight of her objectivity.
That's what I tried to point out.
She didn't want to hear it.
No kidding.
You know how I told you I don't get involved with my patients because they're already dead? You see, actually, I care a great deal. Heart weight 15 ounces. I care enough to dig around inside of them to figure out why they died in the first place.
She don't break down every time one comes in here.
Well, and neither do you in the ER. I think that we prove how much we care by how well we do our job, not by how many tears we shed. And I think Susan's lost sight of that. She's forgotten for the moment.
How do I help her remember?
Jesse, you have to find a way to show her that there's something beyond her own pain.
Thanks, I'll try.
Okay.
The slope is 32/79. That can't be right. The test is in 2 hours.
Got 3/2.
This is all wrong. Everything is all wrong since Shannon's accident.
Everything's been all wrong since Noel came to Norrington.
The things she makes people do.
That accident, Shannon shouldn't have died.
Chad's really lost without her. quarterback, and the cheerleader. What a big cliche. Except, I think it was real.
Ike was so high-tech. Anything could have happened to it.
I wonder if they ever, got together.
I don't know. I kind of hope so. I think they cared about each other.
Yeah, me too. I hope so. I can't.
Kelly? Kelly, look at me.
I'm sorry.
It's okay. It was nice.
No, it was wrong. I don't care what she says.
Noelle did this?
She said...
I don't want to know what she said. Look, if we do this, it's gonna be because we want to, not because...
Difficult morning, Eric?
How could you do that?
What exactly is our common point of reference?
Kelly.
You're welcome.
No, nothing happened.
Oh, dear. She let you down. She let us both down. How unfortunate.
I don't want you doing me any more favors, Noelle. Kelly and I will find our own way. No more favors. Not for me, not for anybody. We're finished.
You let us all down. Eric is very unhappy, but the health department will be overjoyed. No, I don't. I'll try again. I'll get it right this time. It's all right, Kelly. It's been taken care of.
Kelly, are you all right? What is school? Your parents?
No.
Somebody help! Get up!
We need help over here! No!
I'm a doctor. I'm sorry. He's gone.
He died of respiratory arrest.
Well, that doesn't help us much.
I know, but the mucous membranes in his gastric system show shrinkage and decay.
That sounds like formaldehyde poisoning.
Exactly. So I ordered a complete tox screen. We should know more in a day or two.
Maybe something happened in the school chemistry lab.
He wasn't taking chemistry. He was murdered. And I think Shannon Murphy was, too. Steve, could you do a background check on one of the students, Noelle Landrew?
You think she's responsible?
What I think is, she makes me very nervous.
And that makes her a murderer?
Humor me.
Why should I stop now?
Thanks.
You know, it just makes me so mad. These kids coming in here so young, all that promise wasted.
I know.
And 2 in 1 week. Mark, your students must think that this is a terrible nightmare.
No, I know it's real, all right. It's just, they don't know what to do with the knowledge. Wish there was just some way to make them see. You know something? This might be a good time for a field trip.
Hey, Susan. Hey, how come you haven't returned any of my pages?
We are busy with patients in the ICU, or hadn't you heard?
You know, let me tell you, a couple of years ago, a guy was brought into the ER. He was a young guy, about my age, and, well, he'd been in a car accident. The nurse and I, her name was Carolyn, we lost him. Then we got him back. And and then we lost him, and then we got him back, and we must have worked on the guy for about an hour or so. Till finally, he crashed one too many times, and, well, you know.
Yeah, I know.
Okay, anyway, when we were done, I come out into the hallway, and I sit down. Carolyn comes out, and she sits down next to me, and she says, "Thank you for not giving up." And I said, "Well, you know, you're welcome, but you worked on him as hard as I did." It turns out that guy was her fiancé. A week later, she bakes me some cookies. I mean, can you imagine that?
The moral, Doctor?
The moral is that you are as professional as Carolyn, but you've forgotten that.
Just because I choose not to be as heartless as she was?
And because you don't do yourself or your patients any good if you're just going to get so involved that you lose it all the time. I mean, you rob them and yourself of your skills, and because of that, hope. I mean, really, that's all we have to give around here.
Well, I hope this is the end of your lecture.
All right, wait a minute. I got an idea.
What are you doing?
We're going to be late for class.
How's the pressure holding?
It's good. 110/7.
The patient's name's Charlie McDonald. He's a senior at St. Agnes Academy. Can't see.
Is he really getting Shannon's eyes?
Her corneas.
Well, why does he need this?
Last week he was in a car accident. His corneas were destroyed. Charlie always wanted to be a pilot. Got his pilot's license at 16. Last spring he was accepted at the Air Force Academy. He was planning on joining them this fall.
Except now he's blind.
Fortunately, he turned out to be a very good candidate for a corneal transplant.
So he'll be able to see again?
The success rate for this procedure is very high.
Good.
You know, it's so good to see something wonderful come from Shannon's death. We can only hope that something just as wonderful will come from Eric's.
Hi. Have you seen one of my students around?
No, why'd you lose one?
Sorry. Did you find anything on Noelle Andrew?
Yeah. She was orphaned when she was 5, and because she had no other family, she became a ward of the state.
Grew up in a foster home.
But she didn't last anywhere longer than 6 months. All her file would say is Noelle became a disturbing influence on the existing family dynamic, whatever that means.
Probably means she learned how to manipulate people at a very early age.
Well, she manipulated the court into giving her adult status when she turned 16. She dropped out of public high school and 1 week later enrolled at Oakley. There were rumors that she was extorting money from the other students.
And nobody could figure out how.
All the headmaster at Oakley would say was that it took a lot of work and a lot of counseling to put the school back together after she left.
My God.
Last year, she was at Trade Winds. The headmaster there wouldn't say anything, but I did find out there was 1 suicide and 2 near-fatal accidents while she was there.
And nothing they could connect to her.
But they were very glad to see her leave. This is one scary young lady.
Oh, and we don't even know what she's doing, really, or how, or why. I think I better find Kelly Gennaro.
Sloan, do you think when somebody dies, that's it? I mean, that everything just stops?
Well, the scientist in me says that since all biochemical activity has ceased, the answer's yes.
The artist?
The artist in me says not a chance.
You know, Eric and we used to sit at a table in a cafe and talk about inventing new dishes and catering Oscar night parties.
Kelly, what do you plan to do at Berkeley in terms of majors and careers?
I don't know. I mean, my parents, they're always talking about law, medicine, academics.
What do you want to do?
They want me to have a solid profession, you know, so that I can have a steady income.
What do you want to do?
I want to redesign the menu. I really do want to redesign the menu. I mean, I love that cafe more than anything else in the world. God, what a mess.
Kelly, you know, the best doctors in the world are the ones who want to be. Same goes for restaurateurs. You know, as long as you know what you want to do.
Yeah, but Noelle knew it before I did. She used it against me.
I don't understand.
Noelle wanted me to seduce Eric. She said that if I didn't, that she would destroy the cafe.
That doesn't make any sense at all. Why would she want you to do that?
Noelle trades favors. I mean, not always. Sometimes she does something nice just because she wants to.
But not always.
She knows what you want most, and she gets it for you. If you do something for her in return. Only this time I didn't do what she wanted, and now Eric's dead.
Kelly, you have to tell me exactly what happened. That's the only way we're going to stop Noelle. I'll meet you down in the lobby.
Thank you for pulling me aside, Doctor. This is a profound experience for all of us, even though some of my classmates are a bit queasy.
How many of those classmates do you own?
I beg your pardon?
How many have you traded favors with?
Favors aren't a bartering medium. See, friends do for each other without the expectation of return. Or are the rules different in the adult world?
So Kelly doesn't owe you anything, even though she failed to seduce Eric for you?
If Kelly told you that, well, then she is suffering from a lack of sleep. Between you and me, I think that she's gotten a bit delusional.
You're very good, Noelle. But I know what you're doing now.
I think you have been working a little too hard, Doctor. You might want to consider giving up the teaching gig, you know, leave the school to the people who should be running it.
I'm going to stop you, Noelle. I promise.
Oh, ladies in distress always think they can count on the gallant knight to rescue them. From a dragon, or an evil troll, or a wicked witch. You learned about that stuff in medieval history class, didn't you, Kelly? Yes. Well, I'm here to tell you that chivalric code stuff is a crock. The knight gets bored, the dragon burns down the castle, and the lady ends up on her own anyway. Leave this place alone. Of course, when the lady refuses to do the favor she owes the wicked witch, the knight dies. Of a broken heart. You did kill Eric. All in all, we're better off without the damn knights anyway. Oh, and their horses make a terrible mess in the living room. What do you want? Bugs. Fire. So many things could put a place like this out of business. What do you want? Put a dropper full of this into Dr. Sloan's coffee. I can't. Of course you can. All you have to do is make a choice. Dr. Sloan or your family. It's not that difficult. Not even for you. There are no knights in shining armor, Kelly. There's only me.
I haven't seen a corneal transplant since nursing school. That was really something yesterday.
It is amazing how such a small procedure can make such a big difference.
To so many people. I'm sorry that I gave you such a hard time before about your story.
Oh, you mean my lecture?
The nursing administrator's ready to kill me, but I asked to be transferred back to the ER.
Are you sure?
I'm not running away, if that's what you think.
Well, no. Yeah, I mean, the thought crossed my mind. Don't get mad at me.
How could I get mad? You reminded me that there's a difference between being detached and not caring.
So you don't think that the ER is just a shuttling of people in and out?
No. Besides, I kind of miss the get me a liter of ringers, and I mean now.
I miss you.
It may take a while for my transfer to come through.
That's okay. I'm not going anywhere.
Thank you.
Morning, everybody.
Morning, Doc.
Thought you'd like to know that our friend Charlie is doing very, very well. We sent him home this morning.
Is it always that fast?
With corneal transplants, yes, it is. Very simple procedure. With heart transplants, on the other hand, sometimes it's 6 weeks before the patient can go home.
So when can he see?
Bandages will come off in a couple of days, probably. Should be able to see almost immediately. You know, if any of you are interested, I could probably arrange with the doctors for you to be there when the...
Are you okay?
Are my parents safe? Of course. You didn't think anything would actually happen to that cute little cafe, did you? It's a community landmark. It deserves to be protected. You made me kill Dr. Sloan for no reason? Nothing ever happens for no reason. And why? Because he was upsetting my friends. I couldn't have a disruptive presence like that here at my school. He would have been gone in a couple of days. I was tired of his lectures and his little field trips, Frankenstein weirdness. What a bother. You made me kill Dr. Sloan because he was a bother to you? I didn't make you do anything. You had a choice. We always have a choice. Did Eric? Of course. Too bad he became a bother, too. You know, he actually threatened me for helping him fulfill his fondest desire. You had no right. And you disappointed Eric and me, which means that you are going to die a virgin. What a shame. What? Trying to think of a second favor that you could do for me in return for that homework assignment that I so graciously got for you. Unbalanced ledger sheets are so asymmetrical. What are you talking about? Your fatal accident, of course. Such terrible luck this school is having. I may have to transfer. You know, with everybody dead, this place is getting to be a real drag, right, Kelly? Nice to see you fully recovered, Dr. Sloan.
Kelly gave me the vial last night. Formaldehyde, the same thing you used to kill Eric Fincher.
Silent, effective. What more could you want from a drug? Don't look at me that way, Dr. Sloan. I didn't do anything but give people what they wanted. Favor for favor. Everybody happy.
Shannon Murphy and Eric Fincher are dead because of your favors.
There are consequences to breaking promises. I learned that a long time ago. They didn't.
But why do it at all? You're bright, you're talented.
That's never enough. People like you, if you do things for them, it's not about who you are. It's about what's in it for me.
Especially if you're a foster child.
Or the new kid in school. Or the odd kid. Or the bright, talented, shy kid. And what you do for the popular kids, they're yours.
Until they finally understand the cost.
But until then, they're grateful and they're happy, and so are you.
Are you? Now?
I will be. I just wanted to be liked.
You take care of her eyes, okay?
Gross examination of John Doe, number 3, reveals a male, approximate age 35 years, primary injury, gunshot wound to the head.
The bullet severed the carotid artery, which combined with the gunshot wound to the left wrist resulted in exsanguination and death.
Hey, you're all alone in here.
Well, the only warm body anyway.
Where's your staff?
Send him home.
Wow, before or after the restaurant shooting was called in?
After.
Leaving you with about a half dozen autopsies.
That's right.
That's a very interesting management strategy you have. And correct me if I'm wrong, but isn't it the boss who goes home and gets a good night's sleep while the underpaid, underappreciated underlings stay here until 2 a.m.?
Not if the boss is responsible for the budget, and we have already maxed out on our employee overtime, okay?
Oh, I see. So then the advantage of being a boss is...
Bags under the eyes, an aching back, and a very short temper. Bye-bye, Jesse.
Bye, I'll see you tomorrow.
Case number 782269. Subject is a Caucasian male, approximately 30 to 35 years of age, 77 inches long, 220 pounds. Preliminary external examination reveals a gunshot entry wound to the left frontal parietal region of the scalp. There's no apparent burn or gunpowder residue or tippling present. He apparently suffered from massive...
Saw him leave, and a naked guy with half his head blown off. It's kind of hard to miss. So I want an officer at every exit, understood?
Yes, sir.
You're lucky to be alive.
Not half as lucky as the man who attacked me.
How does a mistake like this happen?
Well, when the EMTs got to that restaurant, they found a massacre. It was a crisis situation. You know, if the bullet entered just under his scalp and skimmed along the skull, it would have caused massive blood loss, unconsciousness, and also a barely detectable pulse.
Any EMT would have said, bag him, he's dead, and moved on to somebody who still had a chance, like that waitress we still have in surgery.
Well, that explains why he was mistaken for dead, but it doesn't explain why he tried to kill me.
Well, my guess is it had something to do with the shooting. And if that's true, he faces 6 counts of murder. 7 if that waitress doesn't pull through.
No wonder he didn't want to stick around.
Help if we knew who he was.
He took off with all the victims' toe tags, their files, their personal effects.
He's thinking pretty clearly for a guy with a bullet in his head.
Either that or he's deranged, which makes him a danger to everybody in the hospital.
Hey, bonjour, Celine. Hey, what's it like in Paris this morning, huh? Oh, yeah. Well, I've been thinking about you. Yeah, stuff. Good stuff, yeah. So, croissants really taste better over there? Yeah? You miss me? Hey, I'm saving myself for you, baby. Till you get back, I'm a monk. Yeah, weak. No, don't rush off. Money means nothing to me. We can talk as long as you want.
This man is injured, and he's dangerous. And very possibly he's delusional. So if you see him, do not try to handle him yourself. Call security immediately. I don't want anybody around here taking any chances. Any questions? Okay, let's get back to work.
We lifted a bloody fingerprint off the stairwell railing. We're running it through NCIC right now.
Then he's definitely in the building.
The waitress come out of surgery yet?
Yeah, but she just had a bullet taken out of her chest. It'll be a while before she comes out of the anesthesia.
Well, let's hope it's soon. She's the only witness we've got.
Susan, we have a possible subdural hematoma. Start an IV, ringers, give me a cranial CT, and monitor his blood pressure closely.
What happened to the orderly?
John Doe just broke a mop handle over his head about 15 minutes ago.
Where?
On the 3rd floor.
Did he see anything?
Just stars.
This is Sloan. Get a team to the 3rd floor now.
What was he doing on the 3rd floor?
Distributing meds between long-distance phone calls to France.
Can you give me an inventory of his cart?
His cart, sure, yeah.
your light over this way. There? Yeah, you see anything? Well, let's keep trying. Check this out. See anything?
Those cranial CTs just came in.
Thanks. Huh. Looks like our orderly's skull is pretty thick, like the guy who hit him. Let's keep him overnight for observation. I've got to go get the inventory of his card up to Mark.
I was thinking, we both have a couple of days off starting tomorrow. What do you say we finally go up to Carmel?
Shh. No.
But we've always talked about going and we've never been.
Because every time we try to go, something very, very bad happens. Like the time the Metro Rail tunnel collapsed and left our ER full of casualties.
That was a coincidence.
All right, what about the time your car blew up and your garage burned down?
That was a freak situation.
No, I'm telling you, we even start thinking about going to, and, you know, we're both in a lot of danger.
But I love
Don't say it.
Carmel. It's just so romantic.
You know, so is my apartment. We could stay there.
That settles it. I'm going to Carmel with or without you.
Susan, we got a dead guy walking around the hospital already. You're gonna make it worse. Susan.
I ran prints on all of the cadavers. I was able to ID them all. Lynette Baker, real estate agent. Tony Lowitz, insurance broker. Diane Merrill, aspiring actress. Keith Farley, reporter for the LA Chronicle. Lorraine McCormick, tax lawyer. And Bruce Pollard, occupation unknown. However, he had 50 unpaid parking tickets attached to his name.
Meet Gregory Othon.
Yes, I've already had the displeasure. What do you know about him?
Only that he's got a California driver's license, but the address on it is a vacant lot.
Not a good sign.
That's what keeps guys like me employed.
John Doe took some meds from an orderly's cart.
His name is Gregory Othon.
Othan? Should have stuck with John Doe.
Can I get copies of that distributed to all the nurses and doctors?
Yeah, consider it done. Susan?
Othon took Percocet, erythromycin, Bactrim, and ampicillin.
A painkiller and 3 antibiotics.
They're not exactly worth a lot on the street. A lot of patients come into the ER faking injuries for a chance to steal some pills, so you learn quickly which meds are on their shopping list. Which is why I can't figure out why anyone would steal sterile gloves, carbocaine, or betadine either.
When did it happen?
I don't know, but it looks like a hurricane hit the supply closet.
Are you missing any suture kits?
Yes, how did you know?
Steve, we gotta hurry.
Where?
To a vacant OR. Othon's operating on himself.
Could we be sure he's in there?
He took all the drugs and surgical instruments he needed to remove that bullet from his scalp. Whoever he is, he's got medical knowledge.
Stay back.
He was here. We were too late.
At least we know why he stayed. He'll be making us break for it now. I'm gonna double the men at every exit.
His picture's being passed all over the hospital. I'm sure we're gonna catch him soon.
Well, don't underestimate him, Jess.
How can you underestimate someone you don't know anything about?
Well, we know more than you think. He's clever, he's methodical, and he has medical experience.
And a very high tolerance for pain. He took a bullet to the head and he's still walking around beating up people.
And he has something to hide.
Huh. Like his exposed skull, for starters.
No, the address on his driver's license is false. And I am sure that's not all. Otherwise, he wouldn't have attacked Amanda. He would have asked for help.
I need to see a doctor. I don't feel so good.
Excitement never ends.
This is all we have for right now. Let's get a blood sample and see if it tells us anything at all.
Man, it's been a slow night in neurosurgery. Not one consult since 10 o'clock. I could have gone home 5 hours ago. You ask me, the slow ones are tougher than the busy ones. Man, what happened to you?
I've been vomiting all day.
Why didn't you come in any sooner?
I had to get our bid faxed to Budapest by midnight or we could have lost a $3 million account.
You've been working nonstop to get it done, huh?
For 2 days.
Did you eat all your meals at your desk?
I'm thinking of replacing my blotter with a tablecloth. So what do you think is wrong with me anyway?
Well, nothing that a career change and a vacation won't cure.
Have you ever been to Carmel?
In the meantime, we're gonna put you on an IV, replace your fluids, and get you some Compazine to alleviate that nausea. Excuse me. This is Dr. Travis.
I got the results of my background check on Gregory Othon. He has no background.
Excuse me?
No, I ran him through every database we've got. NCIC, VICAP, Social Security, Immigration, the IRS. He's on any of them. It's almost as if he never existed.
Well, what is it with this guy? First, he's supposed to be dead, then he doesn't exist?
I don't know. We're not going to find out.
Guys, there's been another attack.
Is this the man who attacked you?
Could be. But the guy who hit me didn't have a beard. He's in pretty bad shape, though, hiding a bleeding head wound under his scrub cap. What happened to him?
He was shot.
You're telling me I got my butt kicked by a half-dead guy brandishing a shoe?
Well, he got you by surprise.
I got a black belt in karate at home.
Maybe you should have worn it. It's got to be Othon.
He just got a lot harder to recognize. Shaved his beard.
He's just trying to pass himself off as another doctor in scrubs.
Well, you know, Steve, he's lost a lot of blood. He's in no shape to even be walking, much less engaging in hand-to-hand combat. He's got to rest sometime.
How many beds are in this hospital?
400.
I'm gonna have to get some more men.
How long do I have to stay here with that needle in my hand?
8 to 12 hours.
No way. I've got to be at my desk at 9 a.m. working on the Triax multi-products proposal. Cassidy is just looking for an excuse to take my corner office.
You have been throwing up all night. You're dehydrated. If you don't replace those fluids, you could go into shock and die. I bet Cassidy would just love that.
You know Cassidy.
Don't we all? Hi.
Hi.
I've booked a room at the Windermere in Carmel.
Please tell me that you're joking.
Ocean view, jacuzzi, 4-poster bed.
All right, now you've done it. I mean, we might as well stuff our shorts with chum and go diving into a pool of sharks.
You're being ridiculous.
I mean, I wouldn't cross any intersections if I were you. What do you got?
Car accident. We had to peel him out of his dashboard. Neck, chest, and hip trauma.
Okay, let's start him on 5 milligrams of morphine. I want an IV push. Type and cross CDC. Cross the fine.
Dr. Travis needs an orthopedic consult. Could you get Dr. Bishop down here for me? Thanks. God, Miss White.
Diagnosis murder will continue.
She was my patient. I admitted her for food poisoning about an hour ago.
Doesn't look like she responded too well to your treatment.
She wanted to leave. I made her stay.
Jesse, you couldn't have known.
Couldn't have known what? That the dead guy rose off a slab in pathology and is stalking the hospital? I did know, and I admitted her anyway.
Othan killed her, Jesse, not you.
That's great. Remind me of that when I talk to her next of kin.
Well, when you do, ask him what she was doing in this operating theater.
Might ask her what she was doing with this.
Well, that's got to be Othan's.
Not unless he hid it in a body cavity when they brought him in.
So this woman fakes food poisoning so she can roam the halls with a silenced gun? I mean, why would anybody do that?
Because I ordered her to.
Who are you to be giving orders in my hospital?
Martin Rutgers, National Security Agency.
Lieutenant Steve Sloan, homicide. My father is head of internal medicine at Community General. Neither one of us was informed that there was an NSA operation in the hospital.
I'm sorry for any inconvenience.
Inconvenience?
This is a crime scene.
Not anymore.
You're interfering with the investigation of a homicide. Either you call off your man or I'm arresting you.
Is there a place where we can talk in private?
Come with me.
Susan.
This was a U.S. embassy in Addis Ababa. This was a police station in Kosovo.
Yeah, we've seen the pictures on TV.
Maybe you saw this one too, then.
You're saying Othan was responsible for these bombings?
That's our belief.
You want to tell me what an international terrorist was doing having dinner at a Mexican restaurant in Palms?
Othan isn't a terrorist. He's the hired help. Today's events suggest that the last people who hired him weren't too pleased with his work.
6 innocent people were butchered because someone wanted this one man dead?
We considered ourselves fortunate it wasn't 600. When we learned that Othan had died, we considered ourselves blessed.
A state of grace that ended when I ran his fingerprint through NCIC.
And you didn't bother to let us know that he was loose in the hospital.
Whom should I have informed, Doctor? You saw what happened the last time Othan's enemies found him. Do you want the same kind of carnage here? Lieutenant Sloan, it is my intention to lock down this building until we have Othan in our custody or he is dead. Are you going to cooperate, or do you still want to arrest me?
Security has a complete schematic of the building. I'll take you there.
Thank you.
You know, there's one thing I still don't understand. Once you knew Othon was alive, why didn't you lock down the hospital immediately?
Well, Othon was seriously wounded, probably near death. Alana White was my top operative. I assumed that she could take him. I won't make that mistake again.
Sorry to disturb you, sir.
What is it, Jess?
He got Susan.
Susan?
Susan Hilliard. She's a nurse.
Skills?
Excellent. Why?
Show me those schematics.
What's going on in here?
Maybe we're about to find out, yes.
Leave it!
Who are you? What do you want?
Help.
You want a nurse? Find a call button. Is this why you killed that other woman? You were trying to get her to help you.
I need your help.
I told Amanda to call me the minute she got the blood test results on Othon.
Do you think his blood will spell out directions on how to find Susan? Because if not, we're wasting our time.
Where are you going?
Well, I'm going to see if Rutgers needs any help. At least he's looking for the guy who kidnapped my girlfriend.
Oh, he's looking for Othon, all right. At least that part of the story is believable.
And the rest of it?
Rutgers said Othon is a killer, a for-hire terrorist, not acting like one.
He's attacked 3 people and killed another...
And he could have killed all of them, starting with Amanda, and he didn't. Why did he kidnap Susan and not kill her?
I could give you 100 reasons why, each one uglier than the one before.
All right, work on this question. Why hasn't Othon left this hospital?
Maybe he enjoys our warm, friendly atmosphere.
And there may be something here that he needs. I want to know more about what I'm dealing with before I go back to Rutgers. How about you? Othon's sick, isn't he?
His blood shows massive bacterial infection, a kind I've never seen before. Take a look.
Wow, his white blood cell count is 3 times higher than the normal.
With an infection that severe, he's lucky he's still on his feet.
He survived a bullet wound to the head. It's hard to imagine that he'd succumb to a simple infection that fast.
If he doesn't get medical attention soon, the NSA won't have to worry about Othon anymore.
Which is why he's probably still in this hospital.
And why he needed a nurse.
Thank God.
But that still doesn't explain what he's doing here in the first place. Do you have the inventory of all the shooting victims' possessions? Yeah.
What are you looking for?
Medical equipment, supplies, anything like that. Here's an insulin kit found on the scene. Who did that belong to?
I haven't been able to figure that out. According to all the autopsies I performed, none of the victims had diabetes.
I think we're going to be able to help Susan. If you still want to go back to Rutgers, I'll understand.
Then I'm an idiot? What do you need?
Pulled out automatic weapons and started firing. I saw people falling, blood spraying everywhere. And then I felt the bullet enter my shoulder. I crumbled to the ground, feeling my life ebbing onto the cold, hard tile. My last thought, before I lost consciousness, was that I never should have left my mother's farm. And the one man who truly, truly loved me.
Excuse me, Miss Mayfield?
It was the most significant moment of my entire life.
I'm sure it was.
So don't tell me that I should sign any contract that doesn't guarantee me script and cast approval.
I need to talk to you now.
Can you hang on a second, Skip? There's some doctor here. Look, can we just do this later? I'm right in the middle of something.
I need to get some information from you about the shooting.
Sorry, I'm on an exclusive. I can't talk until the hard copy piece airs.
Well, all I need to know is where these people were sitting during the shooting, and I'm sure hard copy's not going to mind that.
Did you hear that, Skip? Sorry. Skip says exclusive means exclusive.
Skip, do you mind if I talk to Skip for just a second? Hi, Skip. This is Dr. Jessie Travis, and I need to get some information from your client here. She was waiting tables when the shooting occurred, and I don't care what it does to your negotiating posture. Miss Mayfield here holds information that could possibly save the life of an innocent woman. No, I don't think she'd be interested in selling her life story. Listen, Skip, if you don't tell your client to cooperate with me, you know, I'm just going to call a hard copy, and I'm going to tell them that your client has been in and out of the psych ward for years and that she's delusional. Okay? What's that going to do for your negotiating posture? Okay.
You... Fine. So what did you need to know?
It's not working.
Try again.
I can't do this. I don't have the training.
If you want to leave here, you will learn quickly.
Thanks, you've been a big help. Any news yet?
No, the hospital's locked up tight. We're still searching all the floors.
What are you doing here, then?
Checking on you.
Look, I found out who was sitting with whom at the restaurant before the shooting occurred.
That's good.
Something the matter?
Yeah, with you, Jess. That's why I'm here.
I'm fine.
Jesse, your girlfriend was kidnapped by a killer.
I'm okay.
You can talk to me, you know.
I am.
No, you're not.
Look, what do you want me to say? That I'm terrified? That I never thought someone could matter to me as much as Susan does? That nothing matters as much to me as her happiness? Or that if something bad ever happened to her, my life would be over?
Something like that. But there's nothing wrong with admitting you're scared, Jesse. Especially to your friends. We can help you.
How, exactly?
Oh, I don't know. Just be there to reassure you. Pat you on the back. Things like that.
You feel better now?
Yeah, much. Thanks.
Glad I could help. You'll keep me informed? First lead you get?
Yeah, you got it. Don't worry, Jess. We'll get her back.
Well, the first attack was in the pathology lab, which is right here. The second attack, where he stole the medication, was outside the oncology department on the 5th floor. The supply room he broke into was on the 8th floor, and the OR where he operated on himself was on number 2. Now, do we see a pattern here, gentlemen?
Only that he seems to move around quickly.
And freely, and that ends now. I want agents posted at each elevator on every floor. And the same goes for the stairwell doors. Huh?
Yes, sir. What, are you gonna lock them down to one floor? Then what? Room-to-room searches from the ground floor up?
Something like that.
It's gonna take a lot of manpower.
Till the ground floor search is complete, the lockdown continues. Follow me. Excuse us. And no one is to enter or leave this hospital until they have been cleared personally by me. Do you understand?
Yes, sir.
Okay, get on. Got it. Lieutenant, do you need something?
No, but I have something you need. In 15 minutes, I can have a squad of police down here to help with the search.
Thank you, but my people are trained to handle this kind of situation.
As is our anti-terrorist unit.
You want to help?
I'm still on the clock.
Good. Then call your people and tell them, until further notice, all emergency services at this hospital are suspended. Say it's,
a gas leak?
Perfect.
When you were informed that Othan had kidnapped a nurse, you asked about her skills. Why?
Lieutenant, when you deal with someone as deadly as Othan, it helps to know what resources he has at his command.
It's the first time I've heard a kidnapped victim described as a resource.
She has abilities and knowledge of this hospital that Othan doesn't. We have to assume she's working with him, willingly or not.
I expect you to treat Susan Hilliard as a victim, not as a weapon.
Notify your people the ER is closed, Lieutenant. You've got work to do.
I can't reach it. How can I help you if you've got me tied up like this?
try again. Carefully.
Othan?
Hi, Dr. Carroll.
I'm sorry for the inconvenience, sir, but access between floors has been temporarily suspended.
What are you talking about? And look, I got patients to see on other floors.
I'm sorry for the inconvenience, sir. We're making every effort to solve this problem as quickly as possible.
It's working. Mark Sloan.
Hey, have they locked down your floor yet?
Locked down the floor? Yes.
Well, then I don't know if this is going to do you any good, but before the shooting at the restaurant, Othan was sitting with Keith Farley. He was a reporter from the Chronicle.
Are you sure?
Well, Gloria Mayfield is, and trust me, this woman knows when she is around people from the media. I gotta go.
I've got to get to Othan before Rutgers finds him.
Mark, even if you know where this guy is, something tells me you've already figured that out. How do you expect to get past Rutgers' men?
How are you fixed for spare parts?
I'm sorry for the inconvenience.
I have a patient open on the operating table waiting for this liver.
We are making every effort to correct this problem as quickly as possible.
By which time this liver will be useless and my patient will be back on a waiting list for 2 years, if she lives that long.
Open the box.
Don't touch it. You'll contaminate the organ and kill the patient. Do you know how long this woman's been waiting for this liver?
Go.
Thank you. Susan, it's me.
Mark, we have to get out of here.
Where's Othan?
I don't know. He could be right behind me.
Or right in front of you?
Well, Dr. Othan, we've been looking everywhere for you.
Now you can finally kill me.
No, that's Rutgers' job. I'm here to save your life.
This man kidnapped me. Why are we helping him?
Because we're the only ones who can, Susan.
It's no use. You'll never find the cure in time.
You heard him, Mark. Maybe we should just go.
That's a little arrogant, isn't it?
Arrogant?
Didn't Dr. Othan tell you? He created this disease.
I can't believe Rutgers told you the truth.
Good. That means the infection hasn't reached your brain yet. I'm going to have to take a blood sample. You know, Rutgers said that you were an international terrorist for hire, but you don't see too many terrorists having lunch with reporters.
I told Farley it was too dangerous for a face-to-face, but it was the only way.
He needed to sample your blood to verify your story. That's why he brought that insulin kit. You used the hypodermic.
We were searched when we left the lab. The only way I could get the plague out was in my own blood.
The plague?
When the NSA sends out assassins to kill a doctor, you begin to wonder why. And then when you discover that doctor's suffering from a bacterial infection you've never seen before.
He's developing biological weapons for the government?
I thought I was.
This country hasn't had a biological weapons program since probably the 60s.
Yeah. And marijuana was outlawed since the 30s, so no one smokes dope, right?
Rutgers wanted you to think you were doing secret government work, but you were only working for him.
creating the friendly plague for the highest bidder. 100% fatal within 10 hours.
It doesn't sound too friendly to me.
It's not communicable person to person. A plane flies over, sprays an entire city. 24 hours later, everyone is dead. We march in, take over the real estate. Nobody on our side even gets a sniffle. And if they do, there's a cure.
Yep, a super cocktail of advanced antibiotics. Susan, would you look in that organ container right under the liver there? Thank you.
Hey, how did you...
You shouldn't leave so much blood lying around if you want to keep this stuff secret.
I was going to give myself the cure when I got back to the lab, but Rutgers found out about the meeting and...
And they sent out a team to kill you and everyone in that restaurant.
It's no use. The contagion's too far advanced.
No, it can't be. Otherwise, everyone in that restaurant died for nothing.
First floor's clean and locked. Search team's commencing floor 2.
I want that murdering bastard dead by dawn. Is that clear?
Yes, sir.
Sloan here.
Steve, can you talk?
I know I said I'd be home right after work, Pookie, but something's come up.
I'm in an abandoned lab in the basement with Othon. He's dying.
Well, I know how much this dinner party means to you. Just go ahead and eat. Don't wait for me.
Rutgers is trying to kill Othon to cover up the fact that he's developing illegal biological weapons. If we don't get Othon out of here, the proof's gonna die with him.
Well, don't worry about me. I'll just pick up something after this is all over.
I need your help. You've got to find a way to get down here.
I'll see what I can do, honey bunch. Until then, keep our guests entertained. Bye-bye.
Problems?
Oh, nothing. A lot of groveling and a trip to the hospital florist can't fix. Excuse me.
Sir?
What is it?
You better listen to this.
Steve, can you talk?
I know I said I'd be home right after work, Pookie, but something's come up.
I'm in an abandoned lab in the basement with Othon. He's dying. Rutgers is trying to kill Othon to cover up the fact that he's developing illegal biological weapons.
I scanned the project documents and uploaded them to this email address. They won't hold up as proof, but it may give you a place to start.
We have you.
Not for much longer. And my corpse won't help you either. The bacteria will die with me.
You aren't going to die.
The doctor and nurse are expendable. No one leaves the basement unless they're in a body bag.
I don't think so. You're under arrest for murder. Now drop your weapons.
How did you know we were monitoring your cell calls?
It's a safe bet. Now drop your weapons.
You've got no jurisdiction here, Sloan. Besides, you can't prove anything. I'll walk right out the door with your badge in my pocket.
There's still Othon.
Is there?
I'll give you 5 seconds to drop your weapons. Then I'm gonna drop you.
I'm not getting a pulse.
Susan.
Jesse. I am so sorry.
For what?
I promise I will never mention Carmel again.
It's too late.
Just keep your hands where I can see.
How's Othon?
He's dead.
In other words, this night never happened. At least your version. I still think I'll take your badge, though, just for the fun of it.
However, the plague is still very much alive. I injected myself with it. In a few minutes, I'm meeting with the authorities and the press.
You didn't really.
It was the only way we could prove anything ever happened here.
Cuff him, read him his rights, and get him out of here. You injected yourself?
Yeah.
I can't believe you let him do it.
Have you ever tried to stop Mark from doing anything?
How long before you have to take the antigen?
I have a few hours.
Well, let's not dally.
Good idea.
What a night.
Tell me about it. I could sleep for a week.
Hey, we have a couple of days off. You want to take a trip?
I don't think so.
Hi, we could get in my car, put the top down, cruise up the coast. By lunch, we could be in
NSA Bureau Chief Martin Rutgers has been arrested and charged with multiple counts of homicide for his role in a rogue operation to manufacture biological weapons. The shocking conspiracy was uncovered by Dr. Mark Sloan of Community General Hospital, who is also
Maybe we should call Mark and congratulate him.
When we get back into town.
Yeah, you're right. No reason running up any long-distance charges.
I am so glad we got over our fear of Carmel.
I'm just glad to be anywhere alone with you.
This couldn't be nicer. Except maybe if the ocean was a little louder.
No problem.
Now it's perfect.
Lab call extension 2768. Lab call extension 2768.
I can't believe you said that.
Okay, no, wait. Denise, hold on. For everyone out there in America right now who may not know this, the three people that may not know this, you have a nationally syndicated radio talk show, right?
Yeah, in 35 major markets, but, you know, who's counting?
And you just throw it out there that you are desperately searching for your birth mother.
Well, not desperate, but...
How about pathetic?
Pathetic is good, yes. Pathetic.
Okay, wait a minute. Let me get this straight. Anybody who knew her knew that she gave you up for adoption could just show up on her doorstep, right?
Yeah, and your point is what?
What about her right to privacy?
Well, what about my right to know?
Hello? How did you find me? Why can't you leave me alone? Let the past stay in the past. Yes, I heard you.
Okay, now, Denise, what about this? What if you find out that your birth mother wants nothing to do with you?
All right, wait, let me see if I understand this. She wants nothing.
Nothing at all. Nothing at all.
The daughter that she gave up at birth?
Right.
She wants nothing to do with her. Well, then I would have to kill her.
Denise, what do you want me to do?
Wait a minute, I'm serious.
Well, so am I.
Oh, please. This from a woman who is never serious. I mean chocolate.
I just don't think I would have any other choice. I would have to track her down and kill her.
Hey, Mark. Yo. Hey, I'm glad I caught you. Which one of these jackets make me look more like a doctor?
This one?
This one. Oh, hey. Which one of these make me look more mature?
Jesse, I'd like to help you. I've got to be somewhere in 20 minutes, and with this traffic, I'm not likely to get out of the garage by then.
Yeah, me too. You know, I gotta go pick up my mom at the airport in an hour.
Oh, your mom? You must be thrilled she's coming to see you.
Hey, getting back to the jackets, just off the top of your head.
I think you should wear the one you like the best. And Jesse, trust me.
Oh, hey, thanks a lot.
You know, Jesse, I don't think your mother's going to care what you wear. She's going to be so happy to see you.
You don't know my mom. She can be very opinionated. She's a little bossy, and she gets what she wants by being really, really nice.
Oh, terrible. Wear the blue one.
I'm late.
Just because I'm conservative, people, doesn't mean I am not a sexy, girly thing.
Oh, baby.
Look who's just walked into the studio. My doctor and our guest for the next hour, Dr. Mark Sloan. Before we go go to commercial, I just want to put out one last plea for information on...
The search for Denise Steiner's mom.
If you gave birth to me, give me a call here, will you? At 1-800-555-BABY. And now, here's a word from the people who helped me pay my exorbitant rent.
Sorry I'm late.
I'm Barney.
Afraid you weren't going to show up.
Hey! Hello, both of you. Steve, this is fabulous. Mondo, we need another set of headphones.
Oh, no. I'm just here for the moral support of my father. But look at you. You look great.
Oh, big compliment. The last time you saw me, I was 12 and I had braces.
I'm so happy for you. Look at this. You're out in L.A., you got your own talk show.
Mm-hmm. We're back in 10. Oh, okay. Why don't you guys take a seat, be comfortable. We'll start.
Don't forget your headsets, guys.
Okay, we are back with the handsome and debonair Dr. Mark Sloan, who has worked with the LAPD in catching many dastardly criminals, right? So, tell our loyal listeners, how did you get involved in murder and mayhem?
Well, Denise, as you know, my son's a homicide detective.
Yes, I do know that, and gorgeous, I might add. In fact, I am seriously thinking about committing a crime just so he'll handcuff me. So, tell me, what is your secret? How do you go about catching a criminal?
Well, you know, solving a crime is very much like making a medical diagnosis. You look for evidence, of course, and you try to put all the clues together. And then you go through the process, sorting out things that don't seem to fit. And if you're lucky, you've got yourself a disease or a murder.
Wow. I usually rely on dating to do that.
Before we get into your mostly imaginary love life...
Hey.
There's a call on line 3. She says she's your mother.
Oh, wow. This ought to be good. Yes, you were on the air with Denise. I was abandoned as an infant Steiner.
Denise?
Yes, you have 30 seconds to convince me you're my mom. Ready? Go.
Oh, my. There's so much I want to tell you.
Oh, sorry, you lose. Okay, let's get back to chatting with Dr. Sloan.
Was the one person who not only knew where Elise ate, but that she was allergic to peanuts. And that narrowed the list of suspects down to one person, her sister.
Well, I guess sometimes it pays to be an only child, huh? Oh, Jen is telling me to wrap it up. We've run out of time. Dr. Sloan, you are fantastic. Promise me you'll come back.
Well...
You heard him, folks. Thank you for listening. I am Denise Steiner. This is my show, and don't you forget it, because I am...
Denise Steiner, the mouth that roared.
And we're out.
Doctor, you were great. Nice meeting you.
You too, Mondo.
I meant what I said. You were fantastic.
You make anybody look great.
Well, thank you for doing the show.
You know, I'm curious about one thing.
Yeah.
You know that lady who called in and said she was your mother?
Oh, yeah, the 175th I'm Denise's mom call.
Yeah, how did you know she was a phony?
Oh, I don't know. Just a feeling. Explain it to him, Steve.
Well, I have no idea. You didn't let her get 2 words out.
She just wanted her 15 minutes of fame. I promise you I will send her a I'm Denise's mom t-shirt, and she'll be a big celebrity in her geriatrics yoga class.
Dr. Sloan? Hi, Stephanie Miller. You probably recognize me from any one of my failed TV shows.
Yes, I think so.
I just heard you on Denise's show. You were great.
Thank you.
You know, I come on right after Denise.
Back off. He's mine. Follow me, gentlemen.
Nice to meet you.
That woman gets on my last little nerve. Hey.
You got a fax from that fakey mother caller, Joanne Lombardi?
No, send it to legal.
No, you might want to take a look at this.
So, is it true? Oh, well, part about the birthmark is true, and I did have a heart valve problem. It was corrected when I was 2, but I had it when I was born.
It's kind of weird, isn't it? I mean, how would she know about something like that? Unless she really is your mom.
Please, get real. I mean, this is just someone who knows I have a birthmark and a heart valve problem when I was born. I mean, there must be hundreds of people who know the 2 things I've never told anybody before in my life.
You've never told anybody?
Oh, well, except for you, of course, and Ricky Hawkins, my 5th grade boyfriend. Have you been talking, Mondo?
No. I mean, except for that small little tiny ad I placed in the LA magazine.
So are you gonna go and see her?
Jesse never once told me what a fantastic hospital this is. I mean, honestly, I'm so impressed.
Well, thank you. We're proud of it.
What you people are doing here, it's like you're a field surgeon. You know, you're really getting in there and you're saving people's lives.
You know, I never thought of it that way, but I think you're right.
Well, of course, you know, my own practice is in a private hospital. You earn a lot more money, but you don't get anywhere near the challenging cases.
Challenging is exactly how I would describe it. Challenging and rewarding.
Well, I'm sure you've got good pension plans and vacation time.
Oh, yes, of course.
At St. Paul Memorial, they make us take 6 weeks off a year.
6 weeks?
They make you?
Or they fine us. Isn't that silly?
I really wouldn't know what to do with 6 weeks off.
No, me neither.
Oh, trust me, it gets old fast. I mean, going to the opera, taking trips to Europe, writing those articles for the AMA Journal. Oh, it gets old fast.
Exactly.
Exactly.
Yes?
I'm looking for Joanne Lombardi.
Oh, my God, Denise? It's you. Oh, wait. I can't believe it. Oh, let me look at you. Oh, my gosh. I can't believe it's really you.
Can I come in?
Oh, yes. I was 16, still in high school. I was so afraid. It was different back then.
I guess.
I made this for you when I was pregnant. And then I couldn't give it to you because I was so ashamed.
Oh, no, please, don't.
They told me you were going with a good family.
I was. I did.
It's the only thing that kept me from the awful pain of thinking I'd never see you.
You did the right thing.
Yeah?
Yeah.
You want a cup of tea?
Yeah, okay, that would be nice. I have a lot of catching up to do. So I'm asking her like a bazillion questions, and she's answering every single one of them. She's answers for all of them, and I'm sitting there and I am talking to her, and I'm thinking, oh my God, you have my nose.
Do my ears deceive me? The cynical Denise Steiner sentimental.
Excuse me. I am part human. Okay? Let's take a call. And it is Tara. You were on the Denise Steiner show.
I had a package delivered to your studio. Did you get it?
A package? Honey, I get 100 packages a day. All right. I get maybe 1 or 2. Okay, I don't get any. What?
I sent it overnight, marked personal.
Okay, I'll look. Well, here it is. Is this it? Yes, it's addressed to me, Denise Steiner.
Open it.
You know, before I do, I feel obligated, Tara, to ask you a question. Are you in any way related to the Unabomber?
Just open the package.
Okay. Excuse me. In case you missed it, this is the Denise Steiner show, not the Nasty Woman Caller show. I decide what I do and what I don't do, okay? Hello? Hello? She hung up. She actually hung up just as I was gonna bucket her. You know what? I'm gonna do it anyway. This is for you, Tara.
I'm melting! I'm melting! Oh, my beautiful wickedness!
We'll be right back after this.
Hey, we're not supposed to be a commercial. Don't ask me. I don't...
Find the news from outer space to run if she's not back by the end of the commercial. Hey, yo, Denise.
Joanne? 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 Hello? Oh my God. Joanne?
Jen called me. Everybody's worried about you. You all right?
Yeah, I'm fine. I just, had a one-day flu.
Caught the radio show. Met your birth mother.
Yeah.
Would this one-day flu have anything to do with that? What's the matter?
Someone sent me this. She sold me. I was just merchandise. All that talk about how she didn't want to give me up and her pain was just
Well, these are just newspaper articles.
about buying babies.
But nothing about you or her.
Oh, look at this note. One of these babies was you. Ask her, she'll tell you.
Now, anyone could have written this. Did you talk to her about it?
No.
What about your adoptive mother? Did you talk to her?
Ugh, please, I haven't talked to her in 3 years. Look, I have to get dressed. I have to go to work.
Honey, I'm not sure you're in any shape to go to work.
I have to. I'll call you later, I promise.
All right.
Okay.
We'll give you a ride.
That would be great. Thank you.
All right, let's try this one more time. First, you said the woman had short, dark brown hair, and now you're saying it was long.
I don't like the way these girls cut their hair these days, do you? I mean, I think a woman's hair is her crowning glory. Why chop it all off? Her hair should be long.
Yes, well, you are certainly entitled to your opinion, but I need to know what the woman's hair looked like in reality. Can you tell me that?
It should be long.
All right, look, maybe we should just give this a rest. I'll drive you home. We can try it again tomorrow.
Oh, I'd love to, but I have to be home by 2 for the guiding light. I used to be in pictures, you know.
That doesn't surprise me.
So today's topic will be people we'd rather see dead.
How war and legal, we're bound to get sued.
I never forget a face. Anyone will tell you that. Oh, sometimes I forget someone's name. Someone I've known 40 years, but a face. Oh, my goodness, there she is. The girl who ran away. Over there at the bus stop.
Are you sure?
Oh, that's her, all right. I'd know her anywhere.
The one with the baby?
No, that's her on the sign. On the sign. Oh.
So I know that you were all expecting my very own honest-to-goodness birth mother to be on the show today.
I'll be there, my pretty, and my little dog, too.
Yeah, well, that's not gonna happen because it's not a cold day in Hades. Can I say that on the air, Jen? Hades? Because that's where my very own honest-to-goodness birth mother appears to be.
Did she take her kidney with her?
Well, she promised to meet me at the studio today, but just like that other oh-so-important time in my life, you know, the time of my birth, she seems to have taken a powder, ladies and gentlemen. So, I'm gonna ask you all a question. Have you ever come to the conclusion that someone near and dear to your heart is just, I don't know, better off dead?
You're not taking me alive, Warden.
And now we're gonna go to commercial.
Steve?
I'm sorry, Denise, but I'm here to arrest you for the murder of Joanne Lombardi.
Mondo, will you finish up the show for me?
You know, when Jesse said that he was investing in a barbecue place, I thought he was talking about some big old restaurant, you know, part of a chain.
Oh, well, it is sort of small, but the ribs are delicious.
Mm-hmm. No, well, what do you call the decor here? Primitive?
Mrs. Travis, Jesse's accomplished an awful lot.
Oh, I know. I'm really very proud of him. In fact, well, I was going to wait, but what the heck? I'm going to follow my son's example and throw caution to the wind here. Attention! I would like to propose a toast to my son, Jesse, who left the family fold and forged a wonderful life for himself in a strange new land. To Jesse.
Thanks, Mom. I'm touched.
And I also want to make an announcement. Now, I was going to talk to you about this alone, but seeing you here, surrounded by all these wonderful people who love you, well, I wanted you all to know that I am offering Jesse a full partnership in my practice back in Minneapolis, St. Paul. Mom. Now, don't forget, that also includes a 6-week paid vacation every year. Now, of course, I don't expect an answer right away, but I am certainly hoping that when I get back on that plane to Minnesota, my wonderful, accomplished son will be coming with me. So, a toast to the future.
To the future.
All right, this doesn't have to be all bad. I could do a remote broadcast from jail. Think of the ratings.
They aren't gonna let you back on the air until after you've cleared your name.
They're gonna give Stephanie Miller my time slot, aren't they?
They wanted to.
My life is over.
No, but I convinced them to let Mark Sloan fill in just for a couple weeks.
You did? Mm-hmm. You're a goddess.
That's known. Denise, I have to ask.
I didn't kill her. I didn't.
So why did you run? Why didn't you call the police?
I don't know what I was thinking. All I know is that I said on national television that I would kill her, and then there she was, dead. I didn't know what else to do. I just ran, and then I thought if I said I hadn't seen her, who would know? You help Mark with my show?
He's a natural.
Good afternoon. You're on the air with Dr. Not on the air. It's what? 3. Am I on now? That was dumb. I'm sorry. Hello, I'm Wayman. I think I disconnected that call.
That's a record, 8 in a row.
Hello, Dr. Sloan? Hello? Am I on the air?
You're on the air.
Oh, can you hear me? Yes?
We're out of time. But be sure and tune in tomorrow from 3 to 7 for...
It's the Stephanie Miller Show.
This has been the Denise Steiner Show, the mouth that roars.
That's a wrap. Good show, Mark.
That was a disaster.
Hey, don't worry. Everybody has an off day once in a while.
Well, there is some good news. The station agreed to post Denise's bail. So, yeah, they just called me while you guys were on the air.
Oh, that's great. You know, I was just wondering, do they tape these incoming calls?
No, we tape over them.
Well, not for a week. Why?
Well, you remember those newspaper articles sent in by that caller?
Yes.
Well, forensics reported that only my fingerprints and Denise's fingerprints were on there.
You know Denise. She's got a million nutball fans. Conspiracy wackos who believe they're being monitored by black helicopters. Yeah, they probably wear gloves 24/7.
Yeah, I suppose that's true. But, you know, it could be a frame.
A frame?
Well, you know, they never found a murder weapon.
Yeah, but lots of people get convicted without a murder weapon.
Yeah, that usually depends on the strength of the circumstantial evidence, though. What I was thinking is maybe I could listen to those tapes. I could find something in there that helped Denise.
Well, I'll find it for you.
Well, I'm gonna take off. I promised Denise that I'd drop by some books and stuff from her place. Catch you later?
Yeah.
Catch you tomorrow?
Mondo and Denise good friends, are they?
Yeah, they used to date. Denise met him at a station in El Paso. She's actually the one who brought him here.
No kidding.
You know, sometimes I just wish they would get back together because they are so much nicer than the losers they each go out with. Oh, tapes. Yes, I'll get them for you.
Thank you, Jen.
I know which.
Degree murder for the homicide of her birth mother, Joanne Lombardi. How did they get this stuff out so fast?
I do not know. I should have Lombardi's autopsy finished by early afternoon.
Great.
You know, her brother's requesting that we ship her body to Texas.
Texas?
That's where she's from, El Paso.
Hey, Dad, got your page. Hey, Amanda.
Oh, Steve, good. Had the tape analyzed. What tape? You remember the woman caller sent the newspaper articles to Denise?
Yeah?
Had a sound man run through it. Guess what he found? Nothing.
Nothing.
I mean, no stray noises, no ambient sound of any kind.
Well, you think the call came from a sound studio somewhere?
I think it could have been from a radio station, which would narrow down the list of suspects.
Yeah, possibly the women that work at the station.
If she was framed.
I think that this tape, combined with the fact that there were no fingerprints on any of those newspaper articles, is a pretty good case.
Dad, we found a murder weapon in Denise Steiner's house. A White House letter opener.
Which would be consistent with the size and shape of the wounds.
Denise's initials were on it, and aluminol turned up micro traces of the victim's blood.
Why would she hold on to the one piece of evidence that could send her to jail?
Wouldn't be the first time someone held on to incriminating evidence.
You know, I tell a couple of people there's no murder weapon, and suddenly it magically appears. Strike you a little convenient?
Well, coincidental, but not relevant.
Well, does this sound relevant to you, that one of the suspects is from El Paso, Texas, but the victim is from?
Dad, lots of people are from El Paso. I mean, Denise lived there herself for a while.
Oh.
Look, I'm sorry, Dad. I want to believe her, too. Call me when you get the autopsy report.
Yes.
See ya.
Where were we going?
Staff meeting, fourth floor. Jesse?
Hey.
You all right?
Yeah, I was just waiting to talk to Mark.
No, he just left.
What?
Yeah, he went to do the Denise Steiner show, but he'll be back in the morning.
That's great, except I have to give my mom an answer tonight.
Why don't you call down to the radio station?
Well, that's a good idea. Air my dirty laundry in front of thousands of strangers.
It was just a suggestion. Look, I really don't know what to tell you. I'll see you tomorrow.
All right, our topic for today is this. If there's one thing you did in the past that you could go back and change, what would it be?
I should have never kept those tapes because I am not a crook.
And we have Billy Bob from Dallas. Hello, you're on the air with Dr. Sloan.
Yes, hi there, sir. I wouldn't change anything about my past, but I do have a question about the future.
All right.
You see, my mama, she owns a big old cattle ranch in Oklahoma.
Dr. Travis to radiology. Dr. Travis to radiology.
Do I know you?
No. Anyway, you see, she wants me to come on back there and help her run it.
Mm-hmm. And what do you want to do?
Well, see, I don't want to disappoint her, and I don't want to hurt her feelings, and I certainly don't want to move back to Oklahoma neither.
I understand.
So, what should I do?
Well, of course, that's your decision to make, Billy Bob. But I can tell you this. If you do something that's not right for you...
You'll regret it, sweetheart. Maybe not today, maybe not tomorrow, but someday soon. And you'll regret it for the rest of your life.
Jesse?
I gotta go.
Who was that?
That was nobody. Gosh, look at the time. Hey, Mom.
So, you're not coming back to Minnesota with me, are you?
How'd you know?
I heard you on the radio. A cattle ranch?
You knew that was me?
I just wish you had come out and told me instead of broadcasting it to 500,000 strangers.
Okay, look, Mom.
I've got a cab waiting. I'm on my way to the airport.
Ma'am, an appendectomy is something that definitely should be done by your own physician.
Don't!
Thank you. And that's it for...
The Denise Steiner Show, the mouth that roars.
Good show, everybody. And I mean it this time. Hey, I'll see you tomorrow.
Hi. Great show. I was just kind of wondering, are you going to be doing this on kind of a, permanent basis? Because,
You can forget the time slot, Stephanie. Denise is coming back.
Oh, that's good news then.
Mondo, all those voices you do are great. Your family back in El Paso must be very proud of you.
My family's in Guadalajara, man. Mexico.
Oh, I was looking at your bio in the manager's office. I thought that said El Paso.
Well, born in El Paso, but raised in Guadalajara.
Oh, I see.
I'll see you.
Mondo, you remember that tape Jen gave me?
Oh, the nasty woman call here.
Yeah, that's the one. It looks like that call was made from a sound studio. And I was just thinking, isn't there an empty sound studio around here somewhere?
Yeah, there's one, follow me.
Good.
See, sometimes they store stuff in here, but that's about it.
Well, I suppose one of the women who works here could have slipped in here and made the phone call. But who? And what would be the motive?
People have their little resentments,
Like what?
Oh, man, this is hard. These people are like family to me.
Oh, sure, I understand. But, somebody's trying to frame Denise.
Well, it could be anyone from the studio. The receptionist. Who knows? Anybody could have slipped in here and made that phone call.
Yeah. There is one little problem. There's no phone in here. Sloan? Oh, that's great news. Yeah, I'll meet you at the hospital. Denise is out on bail.
Oh, great.
Somebody could use a cell phone in here.
Yeah.
Do you have a cell phone by any chance?
Yeah. Doesn't everybody?
Yeah, I guess you're right. Everybody does. Okay. Thanks a lot, Mondo.
All right.
Hi.
Glad to see you. You all right?
Yeah, I'm fine. I'm just, thrilled to be out of there. So, my lawyer tells me they have a bogus case against me, yes?
No, they've got a pretty solid case. But I have a hunch that might help us.
What?
Can you think of any reason that Mondo would want to kill Joanne?
Mondo? No. My God, I mean, Joanne was my mother. He knows how much I wanted to find her. He would never do something like that. He loved me. He asked me to marry him.
Oh. You turned him down?
Excuse me, Mark. I need to talk to you about the autopsy.
Amanda, this is Denise Steiner. Denise, this is Dr. Amanda Bentley.
Hi. Hi. Joanne Lombardi's autopsy.
Yes, Denise, I'm terribly sorry, but Joanne Lombardi was not your mother. In fact, she wasn't anybody's mother. She's never given birth.
And my guess is Mondo knew that the whole time. Hello?
Yeah, Dad. I talked to my buddy at INS. You were right.
Yeah?
Mondo Arriaga's family was deported from El Paso, Texas, back to Mexico. Mrs. Arriaga, his mother, died there. You want to take a guess at who turned him in?
Joanne Lombardi.
Yep.
I was afraid of that.
You know, there's more. When she turned in the Arriaga family, she also reported almost 100 undocumented workers.
100?
She was working for a man running for state representative. Got him elected. Apparently, a lot of people swear they get even with her. My guess is that's why she eventually left the state.
I see. Thanks, Steve. I'm afraid it's Mondo.
Oh, no. 18th birthday, I had a fight with my mom. My real mom, the one who raised me. I told her she wasn't my mom. I yelled at her, and then I ran out the door before I even blew out the candles in my cake.
I can see how that could happen.
She said she got over it. We never really did, either one of us. I never celebrated another birthday with her again. It was just too painful. Well, then I met Joanne Lombardi, and there I am thinking, she's the one. She's the real one. She's got my nose. I mean, she's a complete stranger, yet I am convinced that, I don't know, blood is thicker than chicken soup, I guess.
You see, we believe what we want to believe.
Well, I can't help thinking if I hadn't made such a big deal out of finding my birth mother advertised on national radio, maybe Joanne Lombardi would be alive today.
Honey, you didn't kill her.
Maybe I helped.
Why don't you get some sleep? I've got to get home to my kids. And thank you for the tea. Denise, you might think about calling your mom and telling her what you just told me. Good night.
Good night.
Mom, are you there? This is Jesse. Could you pick up, Mom? Okay, look, I'm sorry that you left without giving us a chance to talk. I'm sure you're disappointed. But I just wanted you to know that, I love you, and that I am gonna stay here in L.A. This is where my career is, my life is here. But I do love you, and, I guess how you feel about me is up to you. Okay, bye.
I hope we've been some help with your problem. Anyone else out there that has any information on male pattern baldness, give us a call. And we'll be back right after this.
Listen, I just got this audition for this huge national spot, but they need to see me like 5 minutes ago. I know it's an imposition, but...
No, go. 20 minutes left on the show. I'll be fine.
All right, you're the greatest, Doc. Jen, see you.
And, I loved your audition tape, baby.
Hey, thanks, man.
Yeah, the commercial's animated, so we want to play around with a bunch of different voices. Okay with you?
Cool, babe. That's what I do.
All right, good. Let's start with an accent. Maybe like Hispanic or whatever. Okay with you, babe?
Just open the package and smell the mighty aroma.
That's great. Let's try. This is wild. If you can't do it, don't worry about it. But how about same accent, only this time we're a female?
Just open the package and smell the mighty aroma.
Oh, that's fantastic. Really good. How about same voice, no accent? You know, no accento, as they say.
Just open the package and smell the mighty aroma.
How about with a little edge of anger?
Just open the package and smell the mighty aroma.
All right, more anger.
Just open the package and smell the mighty aroma.
Yeah, I think that's the one. Let's play it back.
Just open the package and smell the mighty aroma.
You know, I think we have that voice already on tape.
Just open the package.
We got it from the radio station.
You pretty nearly carried it off.
I don't know what you're talking about.
We're talking about a kid who blamed Joanne Lombardi for the death of his mother. You've always thought she wouldn't have died if she hadn't gone back, haven't you?
This is crazy.
So you tracked her down and started threatening her.
No.
At the same time, the woman you loved dumped you, and you just had to get even.
Then you came up with your brilliant plan. If you could just get Joanne to impersonate Denise's mother, you could kill two birds with one stone.
Joanne went along with you just to get you to leave her alone. She had no way of knowing you were going to kill her.
How could you do that, Mondo?
I wanted you. I loved you.
All right, let's go. You got the right to remain silent.
The Denise Steiner Show, the mouth that roars.
This is Denise Steiner, and I am out of the slammer, and I could not be happier to be back on the air, being abused by my callers, of course, after my cushy stay at the county rest home. And, of course, I am here with my dear, sweet Dr. Mark Sloan.
Who is more than happy to turn the microphone back over to you where it belongs.
Thank you.
Yo, Bones. Got a call for you, line 2.
Bones, that's me. What? Hello, you're on the air with Dr. Mark Sloan.
Dr. Sloan, I want to thank you for a call you took the other day with my son. What you said to him about living his own life. Well, after that call, he stood up for himself. To me. Maybe for the first time. I want to tell him I'm proud of him. And I love him, too.
Wow, that is so sweet. That is so sweet. And, well, y'all know what I think of sentimental claptrap. Man, I am gone a week. I was only gone a week, and the Sacred Squad takes over.
Oh, speaking of that, Denise, we have a little surprise for you.
Really?
Happy birthday
to you.
Happy birthday to you.
Happy birthday, dear Denise. Happy birthday to you.
Oh, well, that is incredibly thoughtful. They brought me a cake. But completely misguided because, in case you forgot, my birthday is until next August.
Yeah, well, we know that, but, you know, it kind of is your birthday because, well...
Mom?
Happy birthday, honey.
Mom, oh, my God. You called my mom?
Somebody had to.
For those of you who don't have television simulcast, which I guess is about everybody, Denise Steiner, the mouth that roared, is now hugging the woman who adopted her, raised her, and who she thought she would never see again. Denise, blow out your candles.